𝗵𝗔 is giving you the system-based lectures, my dear doctors. Welcome to the new system, that is respiratory infections. Till now, we have done a lot of systems. We have done with the general microbiology. Now, this is the perfect time to focus our concepts, to focus on the concepts of respiratory system. And as I do the dictum, I always start the new system with the introduction. In this system, I'll tell you how will we proceed with the respiratory system infection. First of all, we will discuss the introduction part that is going on. Then we will discuss the bacterial pharyngitis. In bacterial pharyngitis, we will discuss two organisms, Streptococcus pyogenes and diphtheria. So how I do is, the topics which we have already discussed, like the Streptococcus I have already discussed to you, I will give the link in the description, so that whenever you are preparing for respiratory system, you don't miss out on this topic, but rather revise it from the previous videos, right? Next will be diphtheria, that will be our core topic, the discussion topic for first video. Next, the topic is lobar pneumonia. The lobar pneumonia topic is going to have two organisms important, 𝗵𝗵𝗵𝗵, although the main organism responsible from the 𝗵𝗵𝗵𝗵 genus to cause the lobar pneumonia is 𝗵𝗵𝗵𝗵 influenza. But since we are discussing 𝗵𝗵𝗵𝗵, I will teach you 𝗵𝗵𝗵𝗵 ducreae also here. But Streptococcus pneumoniae we have already discussed, so I will provide the link when I will discuss the lobar pneumonia. Next is the atypical pneumonias caused by Legionella, Chlamydia, Mycoplasma. Next we will discuss the mycobacteria, the one which is responsible causing the most common disease in India, that is going to be tuberculosis. So we will discuss tuberculosis, Mycobacterium tuberculosis also, and then we will discuss the atypical mycobacteria also. Then we will discuss pertussis, that is the whooping cough, followed by some non-fermenter bacteria such as Pseudomonas, Acinetobacter and Burkholderia, responsible for causing respiratory tract infections. Then we will come on to the viruses, influenza, parainfluenza, mumps and RSV we will discuss, okay. RSV stands for respiratory syncytial virus. Then we will discuss the COVID-19, the pandemic which changed the life of many people. COVID-19 will discuss. Of course, also associated with the rhinovirus, adenovirus and Epstein-Barr virus. In the last video, we will discuss the fungus and parasites altogether. Paragonimus westonmani, that's a parasite. And of course, the opportunistic infections like zygomycosis, pneumocystis jirovecii and your aspergillosis we will discuss. So this was our introductory session. My dear friends, as I say in all the videos, whenever you are studying any bacteria, make sure you brush up your concept of general bacteriology. Whenever you are discussing any viruses, please go to the general virology. While discussing the fungus, please go through the general mycology videos. And similarly, whenever you are discussing any protozoa, please make sure that you see the basics, the general parasitology also. So actually the parasites, not the protozoa. Fine. So before we start with the respiratory system, this is a very important video to know how we are going to proceed, and I hope that you have watched this. Now the picture is all clear and we will start with our class 1 very soon. See you in the next video. Thank you.